decided to compare outcomes for radical nephroureterectomy and kidney-sparing surgery as treatment options for high-grade upper tract urothelial carcinoma, or UTUC, because it is a very rare and challenging condition to manage. Currently, or as it has been, radical nephroureterectomy has been the standard treatment for high-grade UTUC, and it involves removing the kidney and the ureter, and it offers a definitive approach to manage this malignancy. However, it can have significant consequences like decreased renal function and the potential need for dialysis. On the other hand, kidney-sparing surgeries, which include ureteroscopic management, percutaneous management, or segmental ureterectomy, is a less aggressive approach and is typically reserved for low-grade disease. So kidney-sparing surgery is also offered for select patients with high-grade disease, often those with significant comorbid disease. And it theoretically has the advantage of preserving kidney function, but it also has potential risks associated with the need for ongoing surveillance for cancer recurrence and repeated invasive procedures. And because the evidence regarding clinical and oncologic outcomes after managing high-grade UTUC is not robust, we aimed to do the study to compare the outcomes of these two approaches in the specific context of high-grade UTUC. Our study was a retrospective review of medical records from patients treated for high-grade UTUC at our institution between 2015 and 2021. We included patients with high-grade disease who underwent radical nephroureterectomy or kidney-sparing surgery and followed up for at least 1 year and collected demographic details, tumor characteristics, and treatment specifics. Our primary goal with the study was to compare oncologic outcomes such as overall survival, metastasis-free survival, and recurrence-free survival to evaluate the effectiveness of the two treatments in controlling UTUC over time. We also looked at clinical and procedural outcomes like the total number of procedures, the total time the patient spent under anesthesia, the duration of hospitalization, estimated costs of care, and changes in renal function. We actually found with our study that there were no significant differences in the long-term oncologic outcomes between patients treated with RNU versus KSS, or radical nephroureterectomy compared to KSS. And the long-term oncologic outcomes between the two treatments were really similar in terms of the 5-year overall survival, metastasis-free survival, and the recurrence-free survival. It was one of the unexpected findings. We traditionally, radical nephroureterectomy is perceived as the more definitive treatment for high-grade UTUC because of its comprehensive approach to removing the cancer. So we anticipated that with radical nephroureterectomy, by virtue of its radical nature, would just yield better oncologic outcomes compared to the more conservative approach that is KSS, or kidney-sparing surgery. And we think that our study, being a single center study and retrospective, inherently faced limitations in the number of cases available for analyses, and our small sample size could have limited the power of our study and our ability to detect a true effect. And because high-grade UTUC is a very rare disease, we think there needs to be future research that is multi-center or with larger sample sizes to get more number of cases to detect a significant difference. But yeah, another unexpected finding we had was the lack of significant differences in the long-term decline in renal function between the two groups, even though we expected that kidney-sparing surgery would preserve renal function. We found that actually patients who were treated with radical nephroureterectomy and kidney-sparing surgery had shared similar creatinine and GFR values before and after intervention, and the two groups had no significant differences in the development of chronic kidney disease either. And that could also be a function of the sample size of our study. For this study primarily, we focused on comparing the outcomes of radical nephroureterectomy and kidney sparing surgery in a select cohort of patients with high-grade UTUC rather than detailing the criteria of selecting treatment based on specific patient or tumor characteristics. We did collect these data points like BMI, ASA classification, tumor stage, size, and focality to ensure that the baseline characteristics between the two treatment groups were similar. But generally, kidney sparing surgery might be considered in patients with solitary kidney, bilateral tumors, or significant comorbid conditions. In contrast, patients without these constraints might opt for radical nephroureterectomy for potentially more definitive control of the cancer. But deciding on the management of high-grade UTUC is still a nuanced approach that requires careful consideration of the individual's patient's overall health, their tumor characteristics, and personal preferences. We aim to provide more information to help clinicians and patients have more transparent discussions regarding the treatment of UTUC. Another just significant finding that we had that was a little bit unexpected was that we found that patients managed via radical nephroureterectomy underwent significantly fewer total procedures compared to those that underwent kidney sparing surgery. But we surprisingly found that patients who underwent radical nephroureterectomy experienced significantly higher perioperative complications than those who underwent kidney sparing surgery. And we also found that the in-network cost of care for radical nephroureterectomy was higher than patients who underwent kidney sparing surgery. So it kind of challenges the perception that kidney sparing surgery is the less favorable option in terms of procedural burden and costs.